I've been working in the emergency department for almost 30 years now, and mental health has always been an issue, but it seems as though it's becoming more of an issue lately. And that's probably for a couple of reasons. Funding is woefully inadequate across the board for mental health. There's also been an increase in substance abuse that we've become, frankly, more aware of. Now, the good side to the awareness with substance abuse, and particularly the opioid epidemic, is that there's more funding and attention being paid to it, but it still neglects a lot of the other problems related to substance abuse and mental health, which do have some natural overlap. For example, alcohol. That is a woefully unattended area. Alcohol abuse is probably one of the number one things that I see in the emergency department, whether it's because someone is acutely intoxicated and behaving badly, or whether it's they're in for a medical problem related to their alcohol abuse. But alcohol, I still see, is one of the largest problems facing society as far as the emergency department is concerned. The injuries, the mental health problems, the physical health toll that it takes. And so from an attention standpoint, I think that's something that we really miss out on. The opioid epidemic is obviously taking a lot more attention because it does take lives acutely. And that is something that needs to be paid attention to because there is a solution to that. But in the big picture, there are probably other things that also need a lot more attention. One thing that I see regularly in the emergency department is a huge segment of society that I basically consider almost discarded by society. They're homeless people who often have significant mental health problems. And we know that, if you have a mental health issue that goes untreated, eventually you're lost to your family, you separate from society, you end up homeless. And people end up, again, kind of discarded by society. I don't really have a ready solution to that problem, but I can tell you that it taxes our medical system incredibly because, frankly, people with mental health problems don't have any place to go. So they come to the emergency department with any kind of problem. Sometimes they're very real problems, but sometimes they're fictitious problems. And we see them, but for every person that we have to take care of that has a fictitious problem or that has a problem that could be managed as an outpatient or some other way, we're taking away from people who have other emergencies that we're, more appropriate to handle. And so that's really another area that I think we've missed the boat on, is taking care of the chronically mentally ill that are essentially homeless and forgotten. Once somebody ends up in the emergency department with a mental health problem that is an acute problem, there's probably been a failure of the system somewhere. And by that I mean, mental health isn't usually something that changes overnight. It's something that gradually worsens. And so by failure, I mean family hasn't really attended to it. They haven't found that person help. Maybe the person was afraid to get help. Maybe they were ashamed, but they didn't get help before it became an acute crisis. So by the time you come to the emergency department in crisis, somebody that's acutely suicidal, somebody that is acutely bipolar, somebody that is psychotic and just out of control of reality. Those are situations that hopefully, ideally, could have been prevented. Now, I'm not going to suggest that all of them could have been prevented because that's not the case. There are things that just change emergently. But oftentimes, these are things that could have been headed off at the pass if there had been better attention, awareness, less stigma, and frankly, better access. That's one of the big problems we have. We have a problem with access to mental health resources across society and in our communities. There is more awareness. There is more attention being paid. There's hopefully going to be better funding because at the end of the day, we can talk all we want about awareness and about attention, but if there isn't money to help take care of people, to get professionals that can talk to them and work their problems out and help them, it's going to be for nothing. Attention without resources doesn't really help the problem. So we do need resources, and hopefully that's something that will change. One of the interesting things, I talked to one of my colleagues about what's really called mental health parity. There are certainly large segments of society that have no resources. They have no insurance or poor insurance coverage, and they need resources from the county. But even if you have insurance, you still have oftentimes limited access to mental health resources. Your mental health days are counted and limited. The number of visits that you have with your provider may actually be restricted in some way. Acute hospitalizations aren't infinite or unlimited. And it's interesting because, well, let me just play the comment that she made.
Access to mental health is actually dependent both upon where you live and what your insurance is. And so one of the things that we in mental health we fight for mental health parity. And that means that you should have just as many visits with your oncologist as you do with your psychologist. So that we're not limiting our access to medical care. We shouldn't be limiting our access to mental health care.
Mental health is really a chronic problem, and there shouldn't really be a limit to the amount of attention that you pay to a chronic problem. You wouldn't say, oh, you can no longer see your endocrinologist, your diabetes days have run out. You need to see that person on an ongoing basis. If you have an ongoing heart problem, you don't have a finite number of visits with a cardiologist, you keep seeing your cardiologist. Well, if you have a mental health problem, you need to keep seeing a mental health professional. And if you don't, you fall through the cracks. Sometimes there are acute situations, I understand, where the intensity of the care may need to be focused on to try to optimize the resources. But really, we need to start looking at mental health as a long-term issue. This isn't something that is a quick fix. There are long-term issues that need constant ongoing care. And I think that's something that we as a society need to evolve toward. I think in some ways we've become a kinder, gentler society. The stigma over a lot of mental health issues has improved, but at the same time, it's still far from perfect. We need better attention. We need people that are more aware of their own issues to come forward and look for help. Interestingly, I talked to somebody, and her first suggestion was that you talk to your primary care provider. You just go to your doctor. Your doctor will hopefully have some better handle on the issue, and if they themselves don't have a practitioner in their office that can help you, that is a psychologist, psychiatrist, whatever, hopefully they know somebody that they can refer you to that will better be able to handle your needs. Oftentimes I see people in the emergency department that have acute mental health crises or mental health problems that is what brings them to the emergency department. But one other thing that I notice is there are a lot of people that come in with other problems, and they are on antidepressants, they're on basically medications for psychiatric concerns. And I've noticed that there has been a steady increase. Now, in some ways, maybe that's good because it means that people are getting attention and they're getting a medication for it. On the other hand, I often wonder, I guess just in my own head, whether or not we don't over-medicate a little bit, or whether some doctors aren't too quick to write a prescription to try and solve a problem. I think that's maybe one of the things that we as a medical community need to focus on, and that's whether everybody really needs to be medicated, or maybe it's something that we just need to understand about the human condition and talk through and work together to try to understand. I mean, no medication is without side effects. And many psychiatric medications have significant side effects. And I guess sometimes I just kind of wonder if we don't jump to medications too quickly. Not to minimize when they're necessary. They are sometimes very necessary, but sometimes it seems as though they're just used a little aggressively. When someone comes to the emergency department and they're in crisis, sometimes that's unavoidable, but oftentimes that crisis could have been treated long before the emergency department visit. Either somebody just needed some more talking, some more attention. They needed their provider to, discuss the issue with them and get a good solution. Maybe they could have directly referred them to an inpatient setting. And it's really frustrating to see situations where somebody comes into the emergency department in crisis when we know that crisis in many ways either could have been averted or handled a little bit differently. So I would really encourage people to talk to their providers and not be afraid to go to a provider to get help before coming to the emergency department. The ER is a very bad place, if you will, to take care of subacute mental health problems. I mean, it's loud, it's confusing. If you come into the emergency department and you're anxious or depressed even, and you start to hear all the noises and get caught up in all the commotion of the emergency department, that is the least therapeutic environment I could imagine. And so really, if you can stay out of the emergency department and get care in another setting, that's probably the best way to go. That said, if you are in crisis, if you have acutely suicidal thoughts, if your family recognizes that you're acutely psychotic, or if you're, perhaps homicidal, or they recognize you're homicidal, the emergency department is probably the right place for you. That's where we can handle things and get you to the best resource. But hopefully the problem gets identified long before that so that you don't end up in the emergency department. One thing that I see a lot are patients that come to the emergency department with substance abuse problems that want to be treated. And I can tell you, unfortunately, most of those people get referred for outpatient treatment. It is very rare that someone has a substance abuse problem that needs acute medical treatment. Occasionally, alcohol withdrawal, for example, that will sometimes need to be admitted to the hospital rather than sent to detox or rehab. But I can't tell you how many people over the years I have seen who come to the emergency department because, frankly, they had an event. Something happened that the straw that broke the camel's back. They come into the emergency department saying, I need help. Something happened. I realize now I need help. And unfortunately, all we can do is refer them to outpatient treatment. It's very rare that we can get them into any kind of treatment from the emergency department unless there's a medical crisis that goes along with it. I guess what I'm getting at is there are county substance abuse hotlines that should be contacted if you're looking for that kind of help to try to get you to the best resource. Sometimes they may identify that the emergency department is the right place for you, but oftentimes it's not. Oftentimes you will just need to present to a rehab facility. But I think it's great when people want treatment. Unfortunately, the emergency department just isn't the best place to get it for substance abuse problems. The bottom line with all of this is really that while mental health awareness has increased, funding has not increased. One thing that I think everybody that has a mental health concern should do is find resources, get help, don't be afraid of the stigma. But that's really the first step, is getting help. Too often people wait too long and problems mount on top of problems. And we know that mental health problems can affect your physical health as well.
Because we know the effects of mental health on our overall physical being. So it's really hard to manage your diabetes if you're depressed. And it's really difficult sometimes to get through all of your cancer treatment if you're anxious and fearful. And so sometimes people think mental health is about being weak in character, but it's not. It's about how do we handle these situations.
Break that cycle somewhere. Get help. Don't be afraid.